I'm Marco Maratea. I'm associate professor at University of Genova in computer engineering. In particular, I work in the Department of Informatics, Bioengineering, Robotics, and System Engineering. And so my background is on logic, in particular languages and tools for knowledge representation and automatic reasoning, and the application to planning a scheduling problem. So what I wanted to do was to share also the vision that the Clear COVID initiative have in order to help the society in this hard period with the background knowledge I have on AI. And so up to now I have done it. I'm doing it. I will try to do also in the real future. This is also because I think that this initiative is very important, given that CLARE is the largest worldwide initiative around AI for a number of researchers involved. And in this task force, our goal is we aim to solve with AI problems that can improve people's wellness and safety in an automatic way. The name of the topic is scheduling and resource management. So the topic is relevant, especially in the healthcare domain, and so because this is central to the pandemic. And this is important given there is the need to solve many operational and organizational scheduling problems and to use resources in an efficient way, given that such resources are often scarce. So think about the beds in the intensive care units. Moreover, what I think is relevant and important as far as techniques are concerned is that in this topic, such planning scheduling problem that I will go later to describe a bit more into details are solved mainly with the deductive techniques. Deductive techniques are the other side of the moon of artificial intelligence that complement machine learning and deep learning techniques. So in this task force, we are able to employ the full range of AI techniques and methodologies in order to attack the problem of interest. So still about the topic, initially there were around 30 researchers, both from academia and small medium industry involved in the topics. The work was organized in subtopics and subgroups, constructed with a bottom-up approach. And each subgroups working on a specific issue and some specific sub-problems. And so the outcomes we are interested in are software empowered by artificial intelligence techniques for solving specific healthcare tasks in an automatic way. During the pandemic, so workflow organization and resource management are key aspects. So these are even more important than in, let's say, normal days. And interestingly, I think that they will be even more important and they will have even more impact as in the post-pandemic, that of course all of us, we know that will arrive relatively soon. In the topic and coordinate, we are solving practical problems that arise in healthcare processes, like, for example, efficient waiting list management, workforce organization, think about nurse shift scheduling, and scheduling of operating rooms in presence of scarce resources. For example, beds in the intensive care unit that, unfortunately, we understood in this pandemic how much they are limiting and how much they are important. Personally, one highlight about the initiative I'm working with is the fact that thanks to this initiative I was able to use the ideas, the methodology and the software I'm working with since almost 20 years for solving very relevant and important problem and makes the outcome of my research at disposal and to the service of our society. The problem is that for some of the problem, I would say all the problem I mentioned earlier, it is not clear at all that solutions scale to the dimension that are needed in order to be really really useful in practice. But fortunately, we were able to do so for at least two problems. The shifting of the nurse and the scheduling of operating rooms in presence of scarce resources. Now we are working on basically two directions. The first one is dealing with other problems, both among the ones I mentioned earlier, for example, waiting list management, but also possibly we are considering contingent problems. For example, think about the scheduling of the vaccination plan. That all countries, basically for sure in Europe, but also in all the world are starting vaccinating. The second direction we are pursuing is further reaching the previous solved problem for being more and more realistic and usable. For example, in the scheduling of operating rooms, we also considered to add beds in the post-anesthetic care unit, because fortunately not all the people, not all the patients need to go in the intensive care unit. A last interesting thing is that we are also working on adding explainability features to our solution toward an interpretable, transparent, and trustworthy AI. Our next steps are to strengthen the collaboration among the members of the topic, and collaborate more closely with other topics, solving more and diverse problems, and also further improving the efficiency and scalability of all of our current solutions, including explainability features. Finally, we would like also to obtain more real data specification for the hospital, which is something that is not always easy to attain. Instead, in the long term, the goal is still working on AI solution useful for people and the society.